What's going on, everybody? Thanks for joining us for another episode of the Black Student Success Podcast, where we bring you insight and guidance from successful Black professionals and students. My name is Selvin, and as always, we appreciate the support. So today we have Chineze Ebo back on the show. She's going to talk about a day in the life in her shoes, what it's like to be a resident doctor within pediatrics, you know, the things that she runs into, obstacles that she has to overcome, and, maybe even some of the joys that she does get in her job. So Chineze, welcome back. How you doing?
I'm doing great. Thanks for having me.
Awesome. So why don't you give our audience just a quick background on kind of, what your position is, where you work, and, before we kind of get into what it's like to actually be in your shoes.
Sure. So I am currently a third-year pediatric resident. So I'm a resident physician in training at Cincinnati Children's Hospital in Ohio. As a third year, I'm considered a senior resident, and this is my final year of pediatric residency. The residency program is 3 years long, and I will be I'm currently applying for pediatric endocrinology fellowship, which is additional subspecialty training. That'll be an additional 3 years.
Okay. All right. Just pushing with the school, I see. Or just
Yes.
Yeah, I get it. We'll definitely kudos to you for just kind of, really sticking to that path. So why don't you talk to us about, what it's like, either a day in the life, what your week is like, what your month is like. And I know, especially with this last month and a half, a year and a half plus with the pandemic, that has also made some changes, some shifts in kind of how you go about your work. So why don't you tell us a little bit about that?
Sure. So within pediatric residency, and I'm sure it's similar to other residency programs, you can either be working on the inpatient side or the outpatient side. On the outpatient side, that is your typical, clinic. So you're seeing patients anywhere from 8 a.m. to 5 p.m. They're coming in for either their well child visits or they're coming in for ill visits, sort of like what you would see at like an urgent care. As a pediatric resident, I have 1.5 day a week where I'm working in my continuity clinic. So this is a chance for me to see my patients and follow up with well child visits, see how they're developing, they're growing, answer any questions they have. I also do some more subspecialized care. So with our patients who might have some developmental delay or some psychiatric conditions like ADHD or some other things like asthma, we typically work with those patients closely. So that's outpatient life. Inpatient life is different. It varies depending on what rotation you're on. When you're just on regular hospital medicine, your day usually starts around 6 a.m. You'll come to the hospital and you'll get what's called sign out from the night team. This is essentially the night team telling you all of the different things that happened overnight with all of the patients on the floor. And so they'll go over any of the labs, any imaging they might have obtained, any acute events that happened that you should know about that happened with the patients. And they'll also talk about any admissions that came overnight. Once you're complete with sign out, you can go ahead and do what we call pre-charting, which is basically looking through the charts of all of the patients and just seeing how, what things happened again overnight, looking at any new things that happened in the morning, if any new labs or imaging came back, looking at notes from other services that might be seeing that patient as well, just to kind of make sure that you're on top of what is going on with that patient. So you're able to talk about them on rounds. After pre-charting, I'll typically go and see the patients. And so that's my chance to do an exam on them, ask them about how they felt things went overnight, maybe even give them some updates about the plan if they have any questions. It's really just my chance to get familiar with the patients, make sure that they know that we're going to stop by again later on that morning and discuss more in depth with them about the plan and things going on for the rest of the day. After pre-charting and pre-rounding, we have something called morning report. With morning report, it's basically a time to take a patient case and go through them. We start off with, what they presented with, what they looked like, what the physical exams were. And then we discuss what other studies would you do for this patient? What labs would you get? What imaging would you get? What are your differential diagnosis? What are you thinking is going on with this patient? It's really interactive, and it's a great way to learn medicine and just discuss with, attendings who might be present or senior residents who are following the patient. And ask questions and better, learn how to assess a patient and things that you should be thinking about. So morning report, and it lasts anywhere from 30 to 45 minutes. After a morning report is typically when rounds start. And so you'll meet with your team. You'll kind of come up with the game plan in terms of how you want rounds to go. So that means, if there's any patients who are, a little bit sicker than others, you might want to round on them first. And so you'll kind of have the discussion beforehand. You'll also discuss any sort of social concerns that might come up, especially in pediatrics. You want families to be part of the conversation. We want to make sure from a social perspective that there's nothing that we're missing that could be contributing to, part of the reason that they might be in the hospital. So we have discussions about that and just prepare for how we want rounds to go. Then we have our formal rounds, which is essentially going to each of the patient rooms. We typically actually go to bedside, having a discussion with the family. We talk about things that happened overnight. We talk about any new studies that we found and discuss what those studies might mean. And then the biggest part of it is coming up with our assessment and plan. This means that, we're talking about what we think is going on with the patient, how we feel like the patient is doing, and what the treatment plan is going to be for the day. This is where we really enjoy talking with families about, because they are just as much a part of this plan as the patient themselves. Their input is really important. And so we call this family-centered rounds because it truly is family-centered. We want the parents and guardians to be involved in medical decision-making. On rounds, we typically have residents, so a resident physician like myself, we'll have our attending, we'll have nurses, bedside nurses. We'll sometimes have nutritionists. We'll have social work, respiratory therapists. So it truly is multidisciplinary. And it's really great because you get to hear the perspectives of various types of healthcare workers. And all of these perspectives are super important and really guide really important medical management for the patient. So it's really great to have so many people at the bedside who can offer different opinions and really come up with an excellent plan for patient care. So rounds after that, rounds can take anywhere from, a couple hours. They can be longer depending on the patient census, how many patients we have on the floor. After rounds, then we put in our consults and finish up our notes. So sometimes if you have a patient who might need to be seen by a subspecialist, for instance, a pulmonologist, a gastroenterologist, psychiatry, you'll typically use the time after rounds to call those consults and let them know, hey, there's this patient that we want you to see, give them a little information about them, follow up with any patients who might be able to go home. So if you're discharging patients, that's the time that you'll try and work to get that done. And then again, just finishing up notes and trying to tie things up. Around noon, we have something called Noon Conference. Again, it's an educational didactic time. Typically, it's a lecture that's given either by a subspecialist. Sometimes we even have really interesting ones from like pastoral care, social work has done some. Sometimes we have our own residents giving Noon Conference. And again, it's just an educational time. We get to eat lunch and we get to learn about some cool stuff. And it's also time away from our, clinical duties. So it's a nice kind of break in the day where you just have time to learn and eat and get a little break from the busyness of the clinical service. After rounds, then it's just kind of time to, again, check in on your patients, make sure everything's going accordingly, deal with any admissions that might be coming in from, ED or direct admissions, and really just kind of trying to tie up some loose ends so that when the night person comes in, you're able to sign out to them all the things that happened during the day, all of the new patients, and just make sure that everything is set up so that the night person has a good night. So that's typically what a day is on inpatient peds. They can be very busy. Like I said, sometimes you're having upwards of 10 admissions. And some of the kids are super complicated. There's times where, some the kids who come onto the regular hospital medicine floor become a little bit more sicker than anticipated, and then they end up having to go to the pediatric ICU. And so that can take some time. But really it's a well-oiled machine. So I think that people know their roles and people are really active, and it's excellent learning because you're directly in charge of patient care and you're having these interactions with families and following up labs and imaging. And so you're really, able to learn from that. I think what I love about my program is that the volume is so high that you learn from experience. You get to see a lot of different diverse pathology and different patient backgrounds, and it's really awesome, and it's a great learning opportunity.
Yeah, it sounds like a very layered day, and I'm glad that you have that that break in between where it's not just you kind of sitting and kind of trying to anticipate before you get back into the fold of everything, but you are utilizing that time to basically learn and kind of interact with your peers in that manner. So it's that's good, and I appreciate the details in each part of the day. One part I want to ask about is when you were talking about the rounds and maybe even the pre-charting. I know that like any job or any career has that one either season or day or time of the year where you walk in and everything is chaos. Have you ever had one of those moments where you guys are talking about the rounds and it's a little bit more complicated in terms of what type of plan you have to go through because either everything that happened the 8 hours before just kind of like made things really crazy? What was that like and how did you get over that?
Yeah, I think it's especially within this pandemic time, we're seeing volumes at times that we didn't expect it. So in pediatrics, we typically have a respiratory season where we have a lot more admissions, a lot more patients who are hospitalized with respiratory illnesses and needing some sort of oxygen support or something like that. And that's typically around this time, maybe going into March. So we were actually seeing pretty high volumes with respiratory illnesses earlier this year. We were seeing, a lot of patients, and we still are seeing a lot of patients who are coming in with COVID and complications associated with COVID. And so it was not uncommon to come in the morning and have, 18 to 20 patients on the list when we're used to census maybe being like 10 or 11 patients. And again, like I mentioned, some of these patients are really complicated. They take time and you need to do more of a detailed pre-charting on them. And so one of the things that we've, been really good at is making sure that we're well staffed when we're seeing that. So making sure we have enough, residents on the team. Sometimes we'll have some visiting residents. So family medicine does rotations at our hospital. And sometimes I think we also might have some psych residents, I think. But we make sure that we have a pretty well-stocked team so that, people are not overwhelmed with too many patients so that the patient distribution is fine. And that's really also the role of the senior. So as a senior, you want to make sure that, you're identifying that, okay, we have a large census right now. Some of these kids are complicated. I'm going to go, let's divide and conquer. So I'm going to go see some of these more complicated patients real quick, keep an eye on them, make sure that everything's fine while I have some of my, other residents taking a look at other patients. And so it's really about teamwork. This is when teamwork becomes really important. This is when communication becomes really important because again, you want to be communicating not just with your residents and your team, but also with the nursing staff and the respiratory therapists and all the people on the floors who are working to manage the patients. So I think the biggest way to help when you have that, when it's kind of overwhelming, is communication and being able to divide and conquer and delegate.
Yeah. Just going back to really the basics of things that kind of help a team move forward, no matter what type of complications that that you might be walking into. Now the last question I want to ask is I know that you have to manage a lot of medical information in terms of knowledge, when you're kind of interacting with different patients and families. On top of that, you're also, there is that, like you said, that social aspect of your job where you are, talking to families, talking to patients and trying to handle, different personalities, different perspectives and everything. And I'm sure that, part of what you studied in psychology probably gave you a little bit of an upper hand with that. But how do you balance, all of the medical stuff and then all of like the people facing skills that you have to utilize to make sure that you're being as effective as possible?
Yeah, I think one of the most important things about medicine and being a doctor is making sure that you're meeting your patients where they're at. So I think, patients will come in with certain conditions, or they're coming in ill. And it's really important to consider the social context surrounding that. What does going home look like for this patient? What is what is their family situation? What's their housing situation? What is their food situation? Is there food insecurity? Are they living in a home that is, especially if they're coming in, for instance, let's say they're coming in with like an asthma exacerbation, and that they're having issues at home where they have mold and roaches and other things that could be contributing to this exacerbation. Really trying to understand the context and what they're presenting with so that you're setting them up for, greatness when they're able to leave the hospital. And that really requires having conversations with these families. And I know it can be difficult because you don't always have that time to sit down and have these well thought out conversations with families, but it is so important, not just from a social perspective, from a medical perspective, being able to explain the logistics of what's going on in the hospital, being able to break down medical facts or medical things, because health literacy is a real concern. And so being able to put things in terms that people can understand, explain what's going on with their children, explain what a disease process looks like, explain what the treatment process looks like, and what this means for homegoing and what they need to do at home to continue to make sure that their child is doing well. All of these things require conversations, and it really requires being attentive to the needs of the family. And so it is a fine balance, because you obviously want to provide medical management and make sure that they're doing well in the hospital, but you also need to understand what they're going to be going home to, what are the things that might have led to their admission in the first place, because that's really going to help make sure that this child has a safe discharge home and will continue to do well outside of the hospital. And so I'm a person who really enjoys interacting with my families. I really enjoy having the conversations. I want to get to know them. I want to understand the background and provide assistance where I can. And that only happens when you talk to them. That only happens when you are able to meet them where they're at, and provide any sort of guidance and support that you can.
Nice. I think just the way that you started that, when you were saying to meet them where they're at, just kind of automatically kind of blends those two things together. And then once you add what we would hope to see from every doctor, just the being as genuine as wanting to get to know the families, make sure that they feel better, being very empathetic in every situation that you can. I think that then that does make either the patients or the families feel as good as they can, no matter how dire the circumstances are. So I love the way that you put all of that together, in terms of the way that you approach it.
Yeah, absolutely. Social economic determinants of health is a real thing. And so you really need to try and understand that social context that is contributing to the medical health, because it's the connection is real. It's there and it needs to be addressed.
Absolutely. Absolutely. Well, thank you so much. You packed a lot of great information in a short amount of time. Was there any little bits or pieces that you wanted to leave our audience with to, kind of let them know of what it's like to kind of walk in your shoes for a day?
Yeah, I really love pediatrics. I think that, working with children is truly a joy. They have an innocence and a resilience that is really amazing to see. And you're part of their development. You're watching them grow and develop in front of you and having them reach these milestones. And it's really great. So if you're considering pediatrics, please reach out to me. I would love to talk to you more about it. It's a wonderful field, and I can't say enough great things about it.
Awesome. And we'll make sure to have all of your information in the description. So Chineze, thank you so much again for sharing your perspective and hopefully giving our audience a little bit something to attach to. Thanks to everybody who's been watching and listening. Feel free to follow us on Facebook and Instagram. That's at Inquire Higher. Check us website out, inquirehigher.com. We got a lot of great information there. And please stay tuned for more episodes as we kind of get into more stories and then more, day in the life of all of our guests. So until next time, peace.